One of the most common complaints I hear from my patients is, why am I so tired? Hi, I'm Hyla Cass, medical doctor, psychiatrist, and advocate of natural health solutions. Severe fatigue or exhaustion can be a serious symptom that should be evaluated by a doctor. However, I believe that one major cause is undiagnosed hypo or low thyroid. This may not always show up in standard tests, but if you're too tired to enjoy life, you may have some sort of thyroid issue. And here's some helpful information and natural options that may help. First of all, what is the thyroid gland? It's a small butterfly-shaped gland that sits in front of your neck. It's the main gland controlling the rate of your metabolism and your energy output. Every cell in your body needs thyroid hormone in order to function. When your thyroid is low, you may feel tired, cold, have dry skin, brain fog, constipation, weight gain, frequent infections, infertility, and even miscarriages. Part of a whole system, the thyroid is influenced by the brain, the pituitary, which sits right here, and the adrenal glands. The brain signals the pituitary gland to release thyroid-stimulating hormone, or TSH, which then tells the thyroid to make thyroid hormone. Then, from below, the adrenal glands can also speed up or slow down the thyroid. So the thyroid interacts with the brain, the pituitary, and the adrenals, all working together to create balance. Here's an easy way for your customers to gauge what's really going on with their thyroid. Measure the body's metabolic fire by taking their basal or resting body temperature, as described years ago by thyroid pioneer Dr. Broda Barnes. This is done during day 2, 3, and 4 of the period using a special basal body thermometer. For details, ask your health provider or check it out online by searching Broda Barnes, B-A-R-N-E-S. The temperature should be between 97.8 and 98.2, and if it's below 97.8, you're likely low thyroid and you may want to do some further testing. Now, there can be many causes of low thyroid. One that I see in my practice is Hashimoto's autoimmune thyroiditis. Long word, but what it means is that the autoimmune process is attacking the thyroid, leading to either an under or overactive thyroid, usually a combination, and that causes mood swings that are otherwise hard to explain. Other causes of low thyroid: high-fat, high-protein diet, excess hormones, such as too much estrogen or too much cortisol, or deficiencies in protein or in trace minerals or vitamins. Then, even without knowing the exact cause, you can greatly support thyroid health with specific supplements, such as iodine and tyrosine, which are used to make thyroid hormone, ashwagandha and gugulipid, which are Ayurvedic herbs that enhance the production of T4, or thyroid hormone, and the conversion of T4 to the more potent T3. Minerals, such as copper and manganese, which are needed for adequate thyroid function, and vitamin B5, or pantothenic acid, which supports the adrenal glands. You can have all of these nutrients in one handy formula with ThyroSense. It can also be taken by those on prescription thyroid medication. For complete thyroid support, take 2 capsules of ThyroSense with breakfast and add a multivitamin mineral as well. ThyroSense is one way you can start back on the road to better health. Remember that thyroid issues may be complicated, but that ThyroSense is simple, safe, and can be taken along with prescription thyroid medications. AdrenaSense by Women's Sense is an excellent partner here, since adrenal fatigue generally accompanies lowered thyroid function. Remember to try the basal temperature program, seek a sympathetic health care provider, and try ThyroSense. You may be surprised at how fast you begin to regain your vitality.